Hi, this is Mrs. Lewicki, and this is just exam review. I'm calling it rapid fire, although this is what the questions you would answer if you were playing our game. So I'll pause at each question, and I would like you to take the time to try to answer it yourself. So the first section is digestion and pancreatitis. So question 1 is, what should the nurse do if the TPN bag is empty and a new bag is not available yet? So what I worry about when the TPN bag runs dry is that their blood sugar will drop. So what I'm going to do is hang a bag of D5W, or most of the time we hang D10W. So that's glucose in water. And you're going to run it at the same rate that the TPN was running at until you can hang the next bag. So you placed an NG tube. So question 2, after X-ray, what is the bedside method for validating placement of the NG tube? And that is checking the pH. And so it should be an acidic pH if the NG tube is in the right place. So how can the nurse improve adherence to a prescribed diet? Well, anytime that you prescribe a diet, whether it's for weight loss, whether it's to treat a disease like cardiac disease or high lipids or GERD, especially if you have cultural concerns, you always want to start with what they're eating. You want to interview them and see what kind of foods they're eating, because you have more success with helping them adapt what they're eating rather than providing them with a specific list of what they can eat and not eat. So what kind of things or would you think are important for self-care at home of somebody with pancreatitis? Let's say you're discharging them. What kind of things would be important? Well, for one thing, one of the primary causes, especially in the Tampa area, of pancreatitis is alcoholism. So you would want them to avoid alcohol. What is pyloric stenosis? Pyloric stenosis is a thickening of the pyloric valve that is at the stomach, where the food enters from the stomach into the small bowel. And it primarily impacts infants 6 months and younger. There is only actually one answer here, but the treatment of pyloric stenosis is surgery, so it will require surgical intervention. Now remember, because it's a narrowing of that sphincter, what do you think, what kind of nutrition would you be providing for this infant prior to surgery? And do you think you're going to be able to use the gut, the stomach, to digest food? So think on that. Question 7. What's an assessment parameter to indicate overall nutritional status of clients? In other words, how do you determine whether somebody's underweight, normal weight, overweight, or obese? And that's through the use of the BMI tool. What are the components of the BMI? And that is height and weight. What are some of the risk factors for acute pancreatitis? And make sure that you know the difference between acute pancreatitis and chronic pancreatitis. So the risk factors for acute pancreatitis are alcoholism, or alcohol ingestion, as I've just said, and gallbladder disease. So if gallstone gets stuck in one of the bile ducts, that puts them at risk for acute pancreatitis. Risk factors for chronic pancreatitis. So there are several more of those. They do also include alcoholism and gallstones. but also includes genetic diseases such as cystic fibrosis, includes high triglycerides, and lupus as some of the factors for chronic pancreatitis. What if you're treating somebody with pancreatitis, what's the nutrition plan for somebody with acute pancreatitis? And we start out as NPO, so nothing by mouth, and then we would introduce TPN for them. So parenteral nutrition. What are some nursing interventions with acute pancreatitis? So one is that will keep them NPO. And then one of the things is they do have a lot of issues with electrolyte loss, like calcium. And so you do have to watch them for muscle twitching and muscle irritability. You want to elevate the head of the bed and keep them in a Fowler's or semi-Fowler's position. So your patient is getting a paracentesis. What's one important direction before they have the paracentesis? So if you're not aware, a paracentesis is when they're going to drain out peritoneal fluid by putting a needle into the abdomen to drain out the fluid. So what other organ is in the abdominal cavity that might have fluid in it? That would be the bladder. And so you want to make sure that they empty the bladder before the paracentesis. What are some complications of TPN? There are several. So they include hypo and hyperglycemia, infection, fluid overload, and electrolyte imbalances. We hope to correct the electrolyte imbalances through the use of TPN, but sometimes they get a little bit off, especially once they start consuming a diet at the same time. What are some complications of enteral feeds? And so that would be aspiration. They could get diarrhea or constipation. They could have problems with their skin integrity, especially if it's a G-tube placement. How do I prevent aspiration when they're on enteral feeds? Well, I want to elevate their head of the bed to Fowler's or semi-Fowler's. And then if I'm laying them flat to reposition, which is normally how I reposition somebody, then I want to turn the feed off or put it on hold while they're laying flat. Central lines is our next category. And so why do patients get central lines? Well, there's a lot of reasons. Sometimes it's to receive medications that are vesicants or caustic to the peripheral veins, high dose electrolytes, to receive TPN and chemotherapy, those are both those caustic medications, inotropic or vasopressive medications that act on central circulation, so you want it to be closer to the heart, and poor veins, rapid fluid resuscitation, and somebody who requires long-term antibiotics. So what are the types of central lines? We have a short-term central line. It's also known more commonly as a triple lumen. We have PICC lines, tunneled catheters, and ports. What are some differences between peripheral IVs and central lines? Well, the main difference is that the tip sits in central circulation. Other differences are how often the site gets rotated. A peripheral site's going to get rotated every 96 hours, where a central line, it depends on the line, and it can be anywhere from a week to in there for life, depending on the line. Dressing changes only once per week, and it is inserted under ultrasound guidance. A lot of times we're using the vein finder when we're putting in peripheral IVs, but that's just a light, a way to shine a light on the veins, and it's not the same thing as ultrasound. How does the nurse help to prevent central line associated bloodstream infections? Well, we want to make sure that we use single-use vials whenever we're getting out of flush or any kind of medication, and most of the time that's what we have here in Tampa. You want to put the alcohol cap on, put an alcohol cap on, a disinfectant cap after every access. You want to wear gloves every time the nurse is handling any part of the central line. You want to use the chlorhexidine alcohol prep for cleansing the site. And those are the main things. The nurse suspects air embolism from the central line. What action should be done after you yell for help? You want to clamp the line and tighten the connections. You want to turn them on their left side and, if at all possible, put them in Trendelenburg. Administer 100% oxygen, and you're going to call the healthcare provider. Next few questions are on blood transfusion. So the client complains about back pain and difficulty breathing within 15 minutes of the blood transfusion starting. What type of reaction is this? And it's a hemolytic or ABO incompatibility reaction. The client complains about back pain and difficulty breathing within 15 minutes of the blood transfusion. That sounds familiar because I just said that. So what should you do? You want to stop the blood, and actually you're going to discontinue the blood. You want to maintain the line with a new bag of normal saline. This patient is unstable. You're going to get vital signs. You're going to notify the healthcare provider. You're going to send the blood bag, filter, tubing, and a sample of patient's blood and urine to the blood bank. Client develops a low-grade fever and chills during the transfusion. What action should the nurse take? This is a non-hemolytic reaction, so this is the stable of the stable versus unstable reactions. You want to stop the blood, but you don't want to disconnect it. You're just stopping it or slowing it down. And then you're going to call the doctor, and they're likely going to give you a Tylenol order, acetaminophen order. And then when you resume the blood, you're usually going to resume it at a lower rate. Remember, though, you still only have the prescribed amount of time to get it infused. What are some symptoms of fluid overload? And this says with blood transfusion because that's what we're talking about, but it's just general symptoms of fluid overload. Shortness of breath, increased respiratory rate, increased work of breathing, crackles and bases, and those are just some of the signs. So, this is a true or false question. A Jehovah's Witness client will accept no blood products. That was a poorly worded true or false question. So let me rephrase it. Will Jehovah's Witness clients accept any blood products? And so I still did a bad job. The answer is that they'll accept some products, not red blood cells, but they'll accept some products, some Jehovah's Witnesses. You can't assume because they're Jehovah's Witness they aren't going to accept anything. So you would they would need to provide you, it's called an advance directives in your book, but a record for the medical record that says what products they will receive.